Hey, welcome everybody. It's time for another episode of Health Talks with Dr. Trinh. The one show, the only show that shows you a path towards a healthier life, one conversation at a time. And today we're going to try and have three conversations, or at least three people to join in on one conversation. Dr. Trinh, let's have you start and identify the panel today here.
All right. Welcome to another Thursday. And want to introduce you guys. Everyone already knows Helene from Mancha, president of the Physicians Cannabinoid Council. And we are grateful to have from Germany, Dr. Alexander Schering. Is that right, Schering?
Schering, yeah. That's right, yeah.
With us today to talk about what he's doing in the world of cannabinoids and all that.
Yeah, and Dr. Trinh, he has an impressive background. I have to read it because it's quite impressive. So he's actually a scientist and technology expert with over 2 decades. I know he looks young, right? But over 2 decades of experience in the biomedical research field, and his interdisciplinary research covers immunology, and I know you're a fan of that, Dr. Trinh, microbiology, cancer research, molecular imaging, and computer tech. And after completing his doctorate research at Northeastern University and Harvard Medical School, he went to conduct a doctorate research, as if it wasn't enough, at the DKFZ, which is the German Cancer Research Institute in Heidelberg, Germany. But there's a specific reason, Dr. Alexander, that you've gone and narrowed your focus on the cancer research and cannabis. Would you mind, first of all, hello and welcome. We're so happy to have you.
Yeah, thank you very much for having me. This is very exciting to meet everyone here. Cancer and cannabis, they kind of go hand in hand. It's almost a cliche now in media as well, when you see cancer patients consuming cannabis, searching for relief. And, I've had personal experiences with cannabis in the family where I could see the effects of it. In this case was tea extract, cannabis extract and tea having effect on a patient that, is quite sick, and seeing the symptoms disappear is quite something when you see it happen. So it's kind of given me an appreciation. Cannabis really wasn't on my radar before then, but it was more at looking at the traditional medicine side of things to see, well, the actual, the modern medicine rather, to fight cancer. But so many of the ways that we treat patients with chemotherapy and new modern treatments, they have such horrible side effects. And, fighting those side effects with something like cannabis can be really, really valuable. And so that's
and I believe you actually helped your father through his own journey with cancer, right? And that's you started to dig into these research and...
Yep. Yeah, I was on the research side of things for a while, but I never really wanted to deal with patients personally, because I don't like to look at people suffer. So, when it was inevitable, then at some point you can't avoid it, and then you was trying to basically find ways to make him feel better, and 2017, medical cannabis was legalized in Germany. It was a huge game changer for a lot of people. And, I've tried the extract in tea and actually now we have CBD cream and things like that in the house all the time for various things.
Wow. Is that the active field you're working on now?
Right now, I'm actually mostly communicating about cannabis. I work for a startup company in Silicon Valley called U4AI, and their first product is it's an online platform called the Pineapple, where it's we're trying to build a platform where everything surrounding cannabis and recreational drug use can be talked about without stigma, and in such a way that it encompasses all of it, the entire ecosystem, including the medical side of the equation and the benefits and the risks as close as possible to medical accuracy as possible.
So
And Dr. Trinh, the Pineapple platform is one of the new partners of the Physicians Cannabinoid Council.
now I get the connection here. Okay.
Tell us more about the Pineapple platform. What is it? What's its purpose? What it's about, and all that.
So the Pineapple is interesting. It's the idea came from actually people out of the tech industry. So there's the three founders, Tuan, Rob, and Jeff. Tuan has been the editor-in-chief for PC Gamer, Maximum PC for a long time, but he's come across, Alan Tech and Tom's Hardware. So he's from the publishing side of things, and Rob and Jeff, they've been, if you have a gaming PC and you have certain equipment like, iBuyPower PCs or NZXT hardware, then you will recognize some of their products. You've probably used them. And they at some point realized that the cannabis space kind of still operates like the tech company in the 90s. And so, they had this idea, why not build a more technology focused company that can offer services to the cannabis industry, but also provide a place where we can get all of these conversations going about cannabis, because they're all fans of cannabis and also other psychedelics. And the problem with it is, if you go and you look at social media in general, often that discussion gets suppressed. It gets, the algorithms disincentivize it. They don't show it to people. People get banned for just, talking about cannabis. And so we're like, okay, we can get these people maybe at some point in the future onto our platform. That way they can be safe to talk about these things. And, I've come in to basically try and bring the medical side of the equation to this whole thing, so we can, because especially for cannabis, the way that cannabis legalization is moving forward is through the medical applications, right? That's what's driving this whole thing. Is of course recreational use is quite prevalent, and there's a lot of opportunities for economic reason, and it's good for the government for taxation reasons, but the people that are driving it are the patients that are looking for relief. And so, making sure that we have a good grasp on what that means from patient side and also from a science side is really important. And to me personally, what's also really important is that the science does not get distorted, which is very, very often the case these days. It's very difficult to understand what is and isn't real. And you have a lot of competing ideologies when it comes to cannabis and drug use in general. And for a layman, it's really difficult to understand. It's who do I believe? And so, when we're talking about scientific discoveries, I like to speak directly to the researchers that made the discoveries, ask them questions that we see from the community directly, so they get the direct answer from the scientists that did the work.
What is the current state of science and cannabis? We've had somebody came on recently and talked about a study at the University of Michigan. You're going to talk about one at Stanford today here. It seems like the big university, UCI, where we are, actually has a cannabis, I don't know what they call it, research center or whatever. It seems like the major universities have been able to get past the stigma of studying this plant and are now seriously doing so. Or am I just seeing a couple studies and trying to turn this into a major movement here? What is the state of scientific study in cannabis today?
So it's really interesting because the way the science is happening is kind of out of order, when it comes to cannabis. Because normally you would think, if we're talking about medicine, you do the research, you find a new mechanism that is helpful to you, then eventually you end up at medicine that you validate, you make sure it's safe, then it gets to patients. Here we have cannabis being used for so long, also in history, and people are already using it. And the science is kind of lacking behind all of this. It's like we can see some outcomes, we can see effects, we can see it's very evident that for some people, cannabis will relieve pain, cannabis will relieve nausea. There's a lot of things that can happen that are very beneficial, but exactly how it works is not as well understood as we would like. And if we compare it with the state of science in general in the biomedical field, it is in its infancy, really. There are certain pockets of research that are happening with cannabis. There's a large group of people that are doing pharmacological studies just about the plant, the terpenes, the cannabinoids that are inside, and just the chemical nature of it all. And there's a lot of that. There's some pain studies, not nearly enough as there should be, and there are some groups that work on specific diseases, but mostly it's MS. There's some cancer things right now, but it's a little scattered. There isn't really it's not very coherent, and not a lot from the medical side of the equation. So I would say it's in its infancy, really.
Yeah.
So whose job is it to drive that forward? Is it the consumer that wants more validation for what they've already been doing? Probably not. Is it the companies themselves who want to expand their market? Maybe. Is it the government that wants to regulate this? I don't know. Who's supposed to be driving these studies forward? Where's the impetus coming?
Well, I think it's coming from all directions.
Yeah, I was going to say the same thing.
just for different reasons. I mean, the people that are consuming cannabis are doing it either because they enjoy it or they are looking for relief or both. You have the government that's incentivized to study the effects of cannabis for safety reasons. And you have the scientists that just want to understand the basic nature of A, the cannabis plant, and B, the endocannabinoid system in the human body, which is a huge discovery. And then you have the researchers that want to do the clinical studies that show efficacy from medical therapeutics and safety also. So really, it's in the interest of everyone to do this. And, yeah.
Yeah, and I'm on the committee that is working with the federal government right now, and like the hesitation and the length of time that things get done obviously creates a void. And when there's a void, it's filled. It's filled by the private sector that has a need, that wants to accelerate things. It's filled by the consumers that want to have the product and cannot wait for the studies to happen. So then it creates a pressure on the governments and the bigger parties to actually accelerate a little bit more.
Yeah, I think it's really up to there's a group of pioneers all over the world that are kind of spearheading everything, and we have a lot to thank there for a lot of people, like Professor Meshulam from Israel. He's just he kicked this whole thing off. And then, right now I'm really immersed in the European market and in the German industry here. There's a lot of very young pioneers that are pushing into making medical cannabis accessible to everyone. It's a very exciting field.
So where are the barriers? What's holding it back then? Is it just this Wild West infrastructure? There isn't sort of a coherent center? Or is it money, or is it government still balking at pushing back at cannabis? I don't. What's the biggest barrier to research right now?
So so there are a number of barriers. The first one is funding. Funding is a problem. You can't do medical research without adequate funding. It's very expensive to do these studies. Just if you're doing animal models, then those animals need to be housed, they need to be taken care of. It's super expensive. Number one. Number two, there are regulatory difficulties when it comes to substances that aren't legal on a federal level. So that complicates things. There's still a lot of stigma around it. I think a lot of people they still look at it as a bad thing that you need to fight. So there's that. There is also a lot of just ignorance, and I mean innocent ignorance of people that just don't realize the significance of the endocannabinoid system. I've gone through all of this immunology without realizing how important the endocannabinoid system is, which the more you learn about it, the more you realize, wow, it's a very, very central system that's so ubiquitous in the body for a reason. And so there's a lack of knowledge in general about both the plant and the physiological effects on the human being. The plant is complicated. It's a polypharmacy of terpenes and cannabinoids that are all bioactive, which is difficult to work with because you have to design your experiments in such a way that you can control the conditions so that you get data that is useful, right? And in Germany, there's a whole different set of problems because the regulations when it comes to medications are much stricter in some ways. Like you can't even advertise any medication to the public. You can only advertise to pharmacists and doctors. And now there's a huge debate going on. Because Germany wants to legalize cannabis for recreational purposes. Right now it's being dispensed by pharmacies. So how is the dispensing going to work? How are the insurance companies going to pay for it? Are the insurance companies going to pay for it? Should we make it over-the-counter medicine? There's a huge set of difficulties that need to be overcome.
A huge ecosystem. But fortunately, if we stay into the study part, we wanted you to talk about the Stanford University massive study that has been conducted over several years, I believe, on the plant. And their conclusion, especially for the cardiovascular system, was not necessarily positive. And you have read this study in details, of course. And why don't you talk to us about this great study?
Yes. So the study in question is called Cannabinoid Receptor 1 Antagonist Genistein Attenuates Marijuana-Induced Vascular Inflammation. That's a handful,
something I was just discussing the other day with my friends here.
Yeah, I am definitely going to embroider this onto a pillow somewhere and put that in the living room. I think that's a very attractive thing to do.
Very attractive title.
It's funny. So obviously I read a lot of these scientific studies when they come out, and this one I was scrolling through and it made me stop because I just reading at the title, you see a lot of titles like this, but it's like published in Cell, and that is very significant because there's a huge amount of medical journals, many medical journals, and they are ranked by how much impact they have. So that means, if you do some research, maybe you have just, a small package of data that can be useful, but you don't have the resources to make a really, really large study out of it. So you need to publish it in a journal that maybe only takes small packages of data and publishes that. That means the impact information like that is going to have is not going to be as big, and it will leave a lot of questions unanswered. But Cell is one of the highest impact medical journals in the world. To publish in Cell is really, really hard. So to me, it was just incredible that there is a cannabis science paper in a journal like Cell. That's a That's very rare. It doesn't happen very often.
What does it mean, published in Cell? Because it's the regular people.
So if you want to publish in Cell, you have to have an extraordinary amount of data. You have to have a lot of data, and you need to answer the question that you're asking from many different directions, not just one experiment. You need to have several experiments that are completely independent, that show the same thing from different directions. That makes the data very robust. Nice. And when the data is very robust, then it has high impact because it is reproducible. And then if it's reproducible, you'll find that a lot of researchers will base their research on this as a foundation to do work on, because this is data you can really believe and really trust. And so to publish in Cell I've seen really amazing scientists despair at the review process when submitting their papers to Cell, because it's peer reviewed, but it's really strict, and you have to have. Usually, that means that if you publish in Cell, you have a lab that has an extreme amount of funding. You usually find that these people have a track record of doing excellent work. It's very it's very robust.
So when did the study come out, and what did it show?
So it came out at the beginning of last year, and I have been basically telling everyone I meet about the study who wants to listen and lets me talk about it, because it is very exciting. So to me, it's exciting because I come from the cardiovascular field, and it's a very vast field, and there's a lot of information about the cardiovascular field that we have, and already that's very robust, because, the cardiovascular disease is such a killer in the world. It's one of the leading causes of death. And a lot of the chronic diseases that people suffer from are basically variants of cardiovascular disease. You have, diseases of the eye that are related to it, the diabetic retinopathy and age-related macular degeneration, very impactful diseases. And so what they showed here is that so we already knew that before. There was indications and evidence that if you smoke cannabis or consume cannabis in general, that there might be a higher risk of cardiovascular disease and myocardial infarctions. That was an idea that was put out there from several studies, epidemiological studies, but also some specific studies. But the data was never really there to nail it down, and the mechanisms of how it was doing that wasn't understood either. And so in this paper, the first thing is they used a really large data set. They used a data set called from the UK Biobank, which is a huge clinical data set of 500,000 patient data, just to validate, yes, cannabis use correlates with increased myocardial risk. And you'll find that if you consume cannabis, you can, just looking at that amount of data, people will have myocardial infarctions much, much younger than they usually would. You can find that in the database, people that are 35 and have a myocardial infarction. So they validated existing information about it. And if you smoke cannabis, you already know this. Yeah, there's an effect on the heart you can feel. After 20 minutes, your heart rate will go up. And so there is an effect that you can immediately feel when you consume it. But so by this, if you just look at that, it's like, oh, this is bad news. This is bad news for cannabis, right? But that's not what this paper is, because they gave us a mechanism of how this happens. So we know that when you consume cannabis, it releases after 90 minutes, starts releasing very well understood cytokines that are involved in the disease progression of cardiovascular disease. It's the MAP kinase pathways, if you want to know, and there's TNF alpha and NF-kappa B involvement. But either way, it's pro-inflammatory, but so not only did they figure the mechanism out, but they also used a screening technique in silico to identify a molecule that can block that effect of THC. And that molecule is genistein. And genistein is very exciting because it is a compound that's very abundant in soybeans. And that means it's food. It's a food supplement. You eat soybeans, it's safe, it's FDA approved, right? And it can block those negative effects of THC on the cardiovascular system. So that is very exciting. That means you can counteract this effect on the heart and the blood vessels just by adding genistein to the mix. It binds to cannabinoid receptor 1 and blocks those effects. But that's not all, because it does not cross the blood-brain barrier. And that is cool, because that means that the effects of THC on the brain stay intact, while the negative effects on the cardiovascular system are blocked. So you can still enjoy all the psychedelic effects of cannabis. We still have the psychiatric advantages of using THC on the brain without the negative side effects on the cardiovascular system. So they showed us, yes, there's a problem, but also here's the mechanism, how it works, which is very well understood in the cardiovascular field. And here's a solution to the problem that is basically FDA approved, which to me is just incredibly exciting. It means that if you design products with cannabis products, you should consider looking at something like genistein to supplement the products with.
So let's go back and dissect this a little bit. I didn't know there was, everybody's always said you can't die from smoking cannabis. And yet you're saying that there is an increased risk of a heart attack if you smoke cannabis.
Okay. So obviously this sounds, it sounds much worse than it is. Or, it sounds very dire when you talk about heart attack, because, you'll say, okay, well, that's a kind of a,
it's a kind of serious
problem. Yeah. So, but no. So, yes, it's true. It's cannabis is one of the safest things you could probably consume when it comes to drugs, because I don't think there's any obvious evident situation of someone overdosing in cannabis and dying. That's not happened. It's not recorded, and it's very unlikely. You would have to consume, I think, like 700 kilograms worth of. If something like that, but even then, that's very hard to do.
Right, exactly.
But the cause and effect are really hard to determine when the time between cause and effect is really long. So when you consume cannabis, the short-term effects are really safe, but we don't actually look at things at such a long time frame usually. So maybe, people have died of cardiovascular disease that was caused by cannabis. It was just never attributed because it happened years later. And then, you go to the hospital because you have a cardiovascular problem. They look at you and they're like, oh yeah, you have arteriosclerosis and there's all of these cytokines that are causing problems. And that's why that was a heart attack. It's unusual that it happens so young, but why, we don't know. And that's because there's a huge amount of time between cause and effect. And that kind of time can really only be mapped out if we use a lot of data to bridge that gap.
I have a question. Was the study done with smoking marijuana, or was it with different products that was concentrated?
Yeah, so they did a lot of things. Because it's a cell paper, so they did a lot of experiments. One of the things they did was they let people smoke a joint, and then collect their blood after 90 minutes and up to 180 minutes, I believe. And then they did a proteomics analysis to identify a cytokine profile from the people's blood. And it showed all of those cytokines in the blood of the patients that were consuming cannabis that are typically responsible for a pro-inflammatory situation that leads to, it was well understood to lead to arteriosclerosis. So there's that. And then some of the mechanistic work was done with isolated THC. I think it was extract or synthetic. I have to check, but either way, it was just THC specifically. So the binding assay, that they were looking at it binding to CB1 receptor that was just THC. So there may well be other mechanisms involved in this. They didn't really look at THC and CBD in terms of the mechanism. Mm-hmm. But the effect is still there if you consume the whole flower. That much is evident. It's just I don't know what the ratio is that they used for that joint, though.
So because smoking on its own is bad for the cardiovascular system. So
yeah, that's right. Yes. Yeah, but they did eliminate that somewhere here, that it was not caused by the smoke inhalation. I don't remember exactly where it was. I think, yeah, but I do remember reading that they controlled for that.
So one more question. I'm confused. I've heard on this show and others that cannabis has an anti-inflammatory characteristic. When you take CBD, one of the benefits is it reduces the inflammation wherever. Right. And yet you're saying that in this instance, it had a pro-inflammatory. It caused inflammation of the heart. Is that correct?
So yeah. So well, it caused the release of pro-inflammatory cytokines. And that is actually something that you see. There's many papers that disagree about which cytokines get made, and the reality is it really depends on which cells you look at, and the time points, and where in the body those cells are, and these situations can be very, very different depending on what the environment is that is getting triggered. So it is very possible that in some context you have anti-inflammatory properties. Also, when people talk about cannabis, usually they talk about the whole flower, so it will depend on the terpene profile and the CBD concentration, just what the exact effect is going to be. Both is possible.
Both is possible. It can cause inflammation in some instances, or stop inflammation. And is it related specifically to any one compound like THC? In other words, if I take that out and I'm just doing CBD, am I less likely to have this effect?
Yeah, absolutely. I mean, here most of the work was around THC. They didn't really look at CBD, but CBD has been shown to be quite anti-inflammatory in several situations. So it's
also considered as an antidote to THC, right?
Right. Yeah. I mean, that's one of the reasons that people like balanced strains, is to just dull out the effects of THC a bit. But that same is true also on the cardiovascular system and all the other effects. And then also, at least there's some data out there that suggests that THC is biphasic in nature, which means that it has one effect at very low doses and the opposite effect at different doses. So it can really, the dosage really matters. The individual's physiology really matters. I think that's a big challenge also that the cannabis industry has to overcome, is that it's not a one size fits all thing. You have to calibrate your cannabinoid therapy to the patient's individual metabolisms, and
talk about that a bit, all you guys here. You had somebody on recently, and there was a debate about whether or not you can just pull out CBD on its own and just use that one compound, or whether it's more efficacious, it works better if you have it in combination with other things, maybe even a little THC. We're all trying to rip the THC out because that's the part that gets you high, and make it accessible at Mother's Market and CVS and everything. But is it more complex than that? And do you have any ideas on that? If THC is causing the heart problems at certain dosages, then why don't we just rip all the THC out of the plant and stick with the CBD? Or does that cause problems in itself? Right.
So there's a very good example of this. It's nothing to do with cannabinoids, but there's a very famous situation where there's a medicinal plant, I think it was the berberis plant, and it had antimicrobial properties. It was used, over many generations to fight bacterial infections. And they identified the compound that was responsible. I forgot which antibiotic it is right now, but it was an antibiotic. They isolated it, and it didn't work anymore. You throw it in bacteria, it does nothing. You give the plant, it works. And you can identify the activity comes from that antibiotic that's in there. Because if you remove the antibiotic from the plant, the effect is gone. So we know it's because the antibiotic is doing it. And what it turned out was, if you take the isolated antibiotic, you give it to the bacteria have a defense mechanism called the MDR pump, which stands for multi-drug resistance pump. And what it does is the antibiotic goes into the bacterial cell, and the bacteria just pump it back out. They have an active pump that pumps out those antibiotics. So they discovered that there is a inhibitor in the plant that blocks the pump. And because the inhibitor in the plant blocks the pump, now the antibiotic works.
It kills the bacteria.
And kills the bacteria. So only when you combine the two substances from the plant do you have the antimicrobial activity. And so this is the issue with cannabis. Is very clearly something like that going on with cannabis as well. And so but we don't know all of the components yet. We know terpenes and the hundreds of cannabinoids that are in the plant do that. Somehow they interact with each other in the system. Yeah.
Yeah, that's what they call the entourage effect, right?
Yes.
The entourage effect, which is,
But
I think my video just crashed. There we go. No,
am I correct in Elaine and Dr. Trinh that many companies are not trying the entourage effect? They're trying to isolate what would be the antibiotic. They're trying to isolate the one wonder drug and pull that out and give it to you. CBD. That's all we got in here.
Because it's controllable, right? If you isolate a CBD compound and you work with that only, you have a little bit more control than when you have constantly dealing with 100 compounds. So you have a lot more control over that. And you also have the fact that you have certain professions that cannot have any trace of THC. So if you're taking the entourage, even if it's 0.3%, over time, you could have a show in a blood test, for instance. Right. So pilots, nurses, veterans, all of these people that really need often to have some of the benefits of the cannabis plant cannot take that if there is a trace whatsoever of THC in it. So isolating all the THC out completely is a safer way in a sense. So that's my knowledge, but we have 2 doctors with us. Let them answer.
So what do you think, Dr. Trinh? Should we be, it seems like there's 2 different ways that the cannabis world is moving. To isolate certain, to investigate and isolate certain compounds and present those to you as isolated things. I get CBD and nothing else because you don't want the THC. You can't test positive for the THC. THC is dangerous. So, or those, you had somebody on before who said, no, you really got to have, there's some combination here. We're not sure what it is, but you got to have more than one compound when you present this if you really want it to work. What do you think?
Yeah, the world of pharma and medications is a what we call a reductionist viewpoint.
Yeah.
Reductionist viewpoint mean you reduce your thinking, your possibilities among all these possibilities to one compound targeting one pathway, targeting one disease.
Right.
And that's how medicine works, is you reduce it to like that one thing to target the one mechanism, to target the one condition. So when you talk about the entourage effect, it is the anti-reductionist viewpoint, where you believe that everything works together to treat something, and it's hard to really when the anti-reductionist viewpoint is a viewpoint that actually works. All right, like taking the entire plant, what Dr. Alex said, but medicine is very reductionistic, right? We want one compound. One compound for one mechanism of action to treat one condition, and that's kind of how science kind of split hairs to find that treatment mechanism pathway.
Well, what do you think about that? What do you think about that, Dr. Alexander? That's a fascinating thing. Dr. Trinh saying that medicine in general, across the board, wants to find the one magic bullet that uses one delivery, one pathway for one specific problem. And they're always focusing on that, kind of reducing it down to one thing, where your example and what we've heard from other people is it might be more efficacious. It might work better if somehow this complex plant is presented as a whole and not as an isolate.
So, so He's absolutely right. Medicine does prefer the magic bullet approach. It's something that the medical industry is basically high on its own drugs here, because they have, it's the insulin of the world and the penicillin of the world that has, basically trained everyone to look for something like this, because it is just so much easier to control the situations in the patient if you have a single drug. And also it's much easier to produce, because then you can make it in recombinant bacteria and you can produce it really cheaply in bioreactors. But actually, I think that we're on the cusp of a revolution when it comes to this, because there's this technological creep that you have to look at, which it means that as we are improving our understanding of medicine, the technology side of the world is improving the technology, including artificial intelligence and all of those things. And I think with the help of artificial intelligence, it's going to be possible to take a complex polypharmacy of compounds in a plant and match it to a different complex situation on an individual level. I mean, look at what Apple is doing right now with the wearable health detection in their Apple Watch. You see how much they're investing into electronic digital records. Imagine the possibility when you have all of that data combined with AI to calibrate the treatment to the patient. I think that's the future, actually. I don't think it is going to be the isolated drugs anymore, because AI is going to make it possible to take very complex treatment options and still cheaply deliver it in a very specific way to a patient.
Yeah, precision medicine.
Yes. Precision, personalized medicine. Yeah.
Yes.
So we got about 10 minutes left. What's the takeaway from this study, and what's the takeaway you want us all to have? Should we be scared of cannabis now because it raises our cardiovascular inflammation? Even though I always thought cannabis and everything reduces inflammation here. Or should I be, is it a warning sign to people who consume too much cannabis? Or is it more than that? It's the plus side that there are other, you mentioned soybeans or something or whatever here, that there are ways to counteract this effect. What's the takeaway here?
The takeaway for me is I'm very excited about this paper, because it signals that cannabis has finally reached the greater, more established scientific world that is doing very good work in cancer and cardiovascular disease. Number one. Number two, these effects are there. They exist. I think it's important for us to know that they exist. So it will spawn more research. I don't think we need to be afraid of it. I think we need to understand it so we can understand the context in which it isn't safe. So we need to figure out what are the conditions that lead to this. And in this case here, soybean diet, why not? I mean, if that's what it takes to fix this problem, I'm going to get some more, pad thai with some soybeans in it. That sounds great. So there's a solution to the problem here that is quite simple. So,
will they build in soybean compounds into cannabis products then to counteract this effect? Is that something we could see?
I would love that. I would love something like this. But I wouldn't just say we should do it without doing more research. I think the research is really interesting. It's a really great platform to do a lot of research with. Packaging genistein with cannabis directly, or making even recombinant cannabis that makes genistein would be interesting. But Germany is an example. You are not allowed to change the plant in any way if you want to get certified in this way. So you cannot actually add something to a cannabis extract. It has to be, the cannabis extract needs to be from the cannabis plant. You cannot add genistein to it, even if it was good.
And you can't add vitamins or things like that, other products, or, yeah, okay, good.
Yeah. I think this is really exciting also for other diseases. There's, for instance, one of the things that came right after this, in response to this paper, I believe, is, look at age-related macular degeneration. It's a field that's very important. 60% of people will get it by the time they're old. Many will be blind. Is one of the leading causes of blindness, which obviously is very impactful for a human being. And it's a cardiovascular. It has a cardiovascular component. It has a pro-inflammatory component. And you know how many papers exist on cannabis and age-related macular degeneration? One paper that came out last year after this. And all they showed is they looked at this data set, the large UK biobank data set, to see if there is something with cannabis and AMD. And they discovered that people who consume cannabis have a much lower chance of getting that disease. However, when they do get the disease, they get it 10 years earlier in life.
Wow.
Oh,
So that is important. That means there's a mechanism here that we need to understand. So we can say, okay, if you're obese and these are your pre-existing conditions, maybe don't do cannabis because here are your outcomes. Or maybe we can change something about the way cannabis interacts with the body so you don't have this. And maybe in this set of patients here, consuming cannabis is good. Maybe that will help you with your eye disease. So it's.
I have a question for Elaine. That you're obviously with the Physicians Cannabinoid Council. You created this partnership with Dr. Alexander and his work he's doing for this other company here, Pineapple.
yeah.
And what is the? I guess this is a broad question here, but I'll throw it out anyway here. Is the Physicians Cannabinoid Council simply to verify? Does it exist simply to verify what's in a product? Because we know we're not sure what's in the product. There is no other regulation.
Right.
You don't know if you're getting this or that or some of this or some of that. Or is it to really put forth some physician guidelines, some warnings, some information out there? Hey, you should be aware of these risks. You should be aware of this study. You should be aware of these compounds and their effect.
So there's a few things to unpack here. The first thing is a program, what we call the Physicians Quality Verified Seal.
Right.
And that is really to verify the quality of the product in a sense that does it contain any possible pesticides, heavy metal, something dangerous for the consumers, because it's out there, everybody's buying it. So let's make sure that there's a filter in between. And also put in check the company that produced the product to see is the label and the ingredients that they say on the label, the potency that they have on the label is correct. So that's what the quality verified seal means. Now, we also conduct anecdotal efficacy studies, meaning that we can do it looks like a mini clinical trial. Obviously, it's not a real clinical trial, but it's a mini efficacy trial to see, does it have an effect, or is it just a product that seems to be like a placebo effect to anybody? So does it have an effect? Does it have an effect that is consistent among 30 or 100, or in the case of Michigan University, which we are helping for the recruitment of the patients to do that larger study on chronic pain. It's about looking at trying to get as much data as possible so that eventually we will be able to give reports like that and be able to give a report that says, that from all the studies, these findings, we should conclude that this, and we also have a few doctors on our console that are doctors that actually have and treat patients and manage, and there's pharmacists as well that are there to really work individually, precision medicine again, individually with each patient to see what is the tolerance of this patient for the disease that they have, so that we help them counter the side effect of their other medications or their other treatment, and they work individually with the patient. So these are doctors and pharmacists that do that on their clinic. Us, we are there to share the results like we're doing today. This is really about the physicians Cannabinoid Council sharing, invited someone to share. It's about sharing, educating. It's about providing information to our council and to the consumers. And in between, verify the quality of the products for the good brands to elevate above, so that the industry doesn't suffer from all of the charlatan products that are on the market.
So it seems like that can be an important add-on for the Physicians Council, because you are a group of physicians. By and large, you're not, but the majority of people on the council are, Dr. Trinh and others. And
I'm the only one that's not a doctor. And someone has to run the business.
Someone has to have a business background. That's your background. Background, big companies. And so I guess I see this as an opportunity to maybe, I know you don't have the money to sponsor trials and to do the investigation yourself, but simply to gather this information, because I tell you, this is the first I've ever heard of this study. I don't think the cannabis industry wants to hear any negative studies out there, and they just want to hear happy news. They don't want you to be confused about, there's enough debate about what's in the product, and then how do I dose the product? What amount do I take? And then how do I take it? Do I smoke it? Do I put it under my tongue? Do I put it on a patch? And all these things. There's enough debate about all of those things without trying to get into the debate of, well, do I need the whole plant or just part of the plant? And is there, in some instances, it's pro-inflammatory. In some cases, it's anti-inflammatory. Now you're just further confusing people. I would think there isn't much motivation in the cannabis industry to shout and talk about studies like this, I would think.
So we established what we call the Journal of Cannabinoid Medicine with Dr. Trinh. We have not published anything yet in it, but we are in the process of publishing. We will definitely publish the Michigan University, for instance. We will also publish all of the anecdotal studies that we do. And that's about really the Journal of Cannabinoid at this stage is really to share information that are a little bit more scientific than just one person that comes and share their stories. And that's how it will slowly progress to be what you're talking about. But again, we're restricted by the same thing as everybody else in the world, is unless we have, FDA approval to be able to conduct studies with the right investigator and the right team. Obviously, we have the capacity of doing it, but we don't have the funding to be able to conduct and the right to do it from the approval standpoint.
Maybe we need a crowdfunding campaign to raise money to get more. I don't say studies per se. I recognize that that's an expensive proposition, but just to share some of this anecdotal evidence or scientific evidence, to gather it someplace and to present it like we're doing here today. Here's something that happened that you may know and has some interesting pros and cons to it here.
That's part of our alliance with the Pineapple and Dr. Alexander Schering, so that we can have a little bit more of that scientific and medicinal aspect to it for the Pineapple platform. First of all, that has, like all the other platforms, trended more for the recreational aspect of it, and now we want to rebalance it a little bit more into the medical and scientific aspect of it, and then so that we are able to share a little bit more serious information when it comes to the medicinal aspect of it, and that's basically how we're going to progress into this.
So last word to you, Dr. Schering. Thank you, first of all, for sharing, Dr. Schering, this information.
That's very good.
I had to do that joke.
right?
I knew somewhere
Yeah,
that was
that
going to
works.
work in there. Okay.
This is incidentally how I have to spell my name so that AI will read it correctly. I have to spell it like Schering, the English word. So,
Right. The last
So,
word to you. What do you want to share with people about this? You're excited
so-
about this? Yeah.
I want to. Okay, so I want people to be as excited about this study as I am because it shows we're moving slowly out of the stigma when it comes to scientific research about this. This is a major study by a major lab doing fantastic work.
And that's major news.
Number one,
That hasn't
major
happened a lot.
news. Number two, we shouldn't be afraid of the answers we find because they all the problems that develop here are also opportunities. For instance, think about it. You eat food that's full of cholesterol, like tasty burgers and whatnot, and we know cholesterol is not good for you. However, look at all the food in the store that has omega-3 on it, right? Genistein could be the omega-3 for cannabis. So it's actually a huge opportunity for cannabis companies to figure this out because they could be the first cannabis product that says includes genistein. It's a heart-safe cannabis.
Yeah, right.
Or that would be, for a cannabis company, I can see how that would be very valuable. So it would be in the interest of the cannabis companies to sponsor and fund research like this. So the funding should actually, I think that would be a good source. And then lastly, the thing that I think is really important is to understand that all of this, like medication and drugs like this, are very much dependent on the context it's being used in. And that is particularly interesting with cannabis because cannabis, it seems like the way that the endocannabinoid system functions, it pushes cells to a state of homeostasis. That means homeostasis basically means returning cells from a state of activity back to like a resting steady state. So what does that mean? It means that your cells in the body, they have a job to do. Not always, but sometimes they need to do something. Like you get an infection, you want your immune system to clear the infection. And then they need to return back to a state of relaxation, right? So, okay, I'm going to wrap it up now. Sorry. So that means if you don't be afraid and consider the context you're using it in. If you need yourselves to do something specific, maybe take a break from cannabis.
Well, we're going to take a break from this conversation. I hope you'll come back and give us
Thank
more.
you.
And Dr. Trinh, take us out.
Yeah. Yep.
Yeah, very fascinating, Dr. Alex Schering. Would love to have you come back and maybe come join our council sometime. I think that.
Oh, absolutely. I think that would be fun. Yeah.
Yes.
Absolutely. I
All
love the whole concept. So I'm in.
Absolutely. Yeah. Well, consider it a formal invitation to join us at the council.
Sounds great. Yeah, I'm definitely up for it.
Well, we want to invite everybody to come back
Thank you,
again
Dr.
each and every week as we continue these conversations here on Health Talks with Dr. Trinh. Streaming live from our studios here at the University of California, Irvine's Field Applied Innovations.